Cancer surgery is often perceived as a test of technical skill, but in reality, it is a discipline defined by judgment, precision, and an immense sense of responsibility. The integration of advanced technology, particularly robotic surgery, has further sharpened this balance, enhancing precision while demanding even greater clinical clarity.
Today on the podcast, we are joined by one of India's most accomplished oncosurgeons, Dr. Anil Herur, the Director of Oncological Sciences at KIMS Hospital, Thane. With close to 3 decades of clinical excellence in surgical oncology, Dr. Herur brings deep expertise in gastrointestinal, breast, head and neck, and minimally invasive cancer surgeries, including advanced robotic procedures and the redefining surgical care of the country.
A gold medalist from Sion Hospital for MS surgery, an internationally trained surgeon with fellowships in Japan, the USA, and South Korea. He has led various cancer programs, pioneered surgical innovations, and expanded the multidisciplinary oncology care across India.
He is also into community service, running an NGO called GKC Trust, which does cancer screening in the rural and semi-urban areas. It has a mammography van which has screened 18,000 individuals till date. He has been felicitated in various forums by the government of Maharashtra for the same. His laurels notably include a felicitation from the Governor of Maharashtra for his work during COVID and the Best Doctor Award from the Indian Medical Association, amongst countless others. Welcome, Dr. Herur. It is an honor to have you here with us.
Thank you. Thank you for having me.
Sir, we recently heard that you performed a robotic surgery on a 91-year-old patient. Could you please elaborate on this case for our listeners?
Oh yeah, that was an interesting one. So 91 years is something that we normally don't get. And even when these patients come, they're very reluctant for surgery. So it's a testimony to the lady's grit and courage that she wanted surgery. She said, I'm diagnosed with cancer. What is the treatment? It's surgery. Let's go ahead and do it. What was important was conventional surgery means that she would have to undergo a lot of pain. And that is why we chose the option of robotic surgery for her. What robotic surgery brings to the table is less pain and early recovery. And believe it or not, the lady was sitting up and walking on day 2 of surgery after undergoing a major surgery for cancer endometrium, which would have otherwise taken her a week to recover from. So that is the difference that technology brings.
Dr. Hill, was there any particular incident early in your career after which you realized that integrating robotics into surgery was the way forward?
So basically, I am a trained open surgeon. So when I was doing my post graduation, there was nothing like even laparoscopy. Okay, laparoscopy had just sort of started to be done. We were not formally trained, but I took on to laparoscopy because I realized that this is the way to make patients more comfortable, and minimal access surgery is the way to go. And that is why we started this journey of minimal access. After having done 1,000 laparoscopic surgeries, we realized that there is something missing because laparoscopy is about straight stick instruments. The instruments don't bend, whereas your human hand bends. And one day when we were doing a particularly difficult rectal cancer case, going deep into the pelvis, we just hoped and prayed if we had an instrument which could go around structures where we could have 3D vision. And that is something that I realized that we have to go ahead with robotics, because that was something that was just beginning. This was somewhere in 2016, when robotics was being established in oncology. It was just coming on to the world. And we took on very, very early to robotics because we realized that that is the way forward. Because otherwise, you are not going to be able to improve upon the advantages of laparoscopy, and that is the thing that robotics brought to the table. As I mentioned in this previous case, that is where we have reached.
With today's advanced surgical arsenal with respect to cancer therapy, how much of a difference do you think experience makes to detect, diagnose, and test?
Oh, obviously. I mean, some things never change, right? Something never change. So basically, like if you are somebody is a medical student, I think the Bailey and Love textbook of surgery never changes. It is eternal. It is eternal. So millions of years can go by and you'll still want to read that book. So the thing about early detection, about clinical diagnosis never changes. Okay. So I'll give you an example that there was this patient, a surgeon's mother, who came with distension, with a bloated tummy, and the CT scan did not show anything particularly well. She had crampy pain. She gave an old history of being operated for hysterectomy. So we were just not able, that the radiological diagnosis was not matching with the clinical signs. So what we did is what we had learned as residents in the pre-CT era. You're young medical students, so you may not know how we used to diagnose blunt trauma abdomen having a bleeding inside the abdomen. We used to put in a needle and take out blood and aspirate. So if we see blood and it didn't clot, it meant that there was free blood in the peritoneal cavity. And that is the way we put in a needle, we got blood, and I said, no, this is something very, very sinister, let's open her. And true to that, there was a gangrenous segment of bowel there. So clinical diagnosis is never going out of fashion. Early detection of cancer is never going out of fashion. You will not ever have a time when you say that come what may, I will manage with machines. I don't think so. Not in my life, definitely.
Right. So you've obviously seen healthcare evolve closely, from surgical robots to the AI-driven ambulances also, which we've seen here. From your perspective, what excites you the most about where healthcare as a whole is headed?
So having said my thing about old things, I always look forward to the new, because we are that generation which has seen everything from dialing phones to mobile and internet. So what healthcare we see today is definitely going to change. I recently heard Elon Musk's interview, and I don't know whether you guys have listened to it, and he said next 2 to 3 years doctors may go out of business. So I don't really believe that may happen, but still the kind of evolution that is happening, we are now having a lot of AI driven software which is going to help in diagnosis, which is going to help in surgery. For example, there is a software now which will tell you that this is a no-go area in surgery. So if you are near a particular important vital structure, like you have in an automated car, like you have your ADAS systems, you will have a warning sign which will have your instrument stop. And this is where we are heading as healthcare professionals. We are entering a very, very different era. It's going to be a brave new world, and I think the way things are going to happen in the next 10 years are going to be completely different from nearly 25 years of the past. So the age of static instruments, non-thinking slave and master models is ending, and you are now going to enter into a partnership with machines, and that is something that is very, very exciting.
So like we have the Da Vinci surgical robot, which is the current ongoing standard. I think what other such emerging innovations or ideas do you think are expected in the next few years? Any specifics?
The next thing that, as I told you, there is going to be large language models and deep machine learning that is going to be integrated in surgery. And what this is going to do is what ChatGPT is doing to all the things that we are doing in our day-to-day tasks. Low-hanging fruits like basic surgical skills are going to be taken care. You will have better patient safety because all these structures will be identified. What will, however, probably not go away is the key decision making. Do I cut this or not cut this? I think that's going to take time, and that is where I hope as humans we still retain control over the machine, because otherwise machines today are becoming smarter by the day, and they might dictate on a lot of things, where I fear that though it's going to be safer for patients in a way, the downside is it might get a lot more commercialized, and that is the fear. The empathy in medicine may just about go away, and that is my fear for the future.
Which is why it has to be integrated in a more seamless fashion so that
yes, absolutely.
Right. Thank you, sir.
Before we conclude, let's move into a quick rapid
Sure.
fire segment. A few short questions to capture your instinctive thoughts and reflections. Are you
Sure.
ready?
Yes,
If given a choice, which specialty would you choose other than oncology?
cancer surgery.
Other than oncology.
It doesn't loud and clear.
I
Listen, listen.
can't think of anything else.
What adjective best describes your profession?
Resilience.
OPDRs or OTRs?
OT.
If you had to play one song during every surgery, which song would you choose?
Kadam kadam badhaya ja. Because I think it resonates. The second line especially. ये जिंदगी है कौम की तू कौम के लुटाए जा. I think that should be the aim of every aspiring young medical professional, young or old.
One misconception people have about cancer surgeons.
That they lack empathy.
Finally, what advice would you give to all our aspiring medical professionals out there listening to this segment of ours?
I think the first and most important message is keep learning. We are evolving, and as I said, it's a brave new world. So keep learning. Be passionate, but don't lose compassion. Be competitive, be ambitious, but don't lose empathy. I think that is the message that I would like to give.
Dr. Hill, we are extremely grateful to you for generously sharing your time with us and for offering such thoughtful insights drawn from your remarkable journey in surgical oncology.
Thank
It
you.
has truly been our privilege to learn from your experience.
Thank you, and I would really like to commend you on this great initiative. Keep doing the good work. Thank you very much.
Great.
Thank you,
To
sir.
all our listeners and the viewers, thank you for joining us on the Pearls of Perspective. We hope this conversation's added depth to the way you think about medicine and its many possibilities. With this, we sign off for today. For more such insightful episodes, please stay tuned. Thank you.
Thank you.